Yes, Nigeria has approved Lenacapavir, a twice yearly HIV prevention injection. You heard me right, a twice yearly HIV prevention injection. In this video, I will tell you what this is, what exactly does this mean, and who should take it. Interestingly, I will be talking about the effectiveness, the cost, and the availability in subsequent videos. The fact is that this pre-exposure prophylactic injection could transform the way HIV prevention is done in Nigeria, in Africa, and in fact, the world generally. So the fact is that Nigeria has entered a new era with the approval that NAFDAC has given for the use of this injection to prevent the transmission of HIV. By the way, for a reminder, HIV, known as the human immunodeficiency virus, has ravaged many nations, countries, including Africa and in fact Nigeria. This virus gives a form of chronic infection that has left many people with morbidity, and in fact there have been many mortalities. Current statistics actually show that about 94.1 million persons have been infected with this virus and about 44.1 million have died due to this virus or related condition. You can imagine the loss that this has created for individuals, families, communities, even nations. HIV can be contacted or transmitted by contact with blood or other body fluids of infected persons. So people who take blood transfusion, improperly screened, people who share sharp objects, razor blades, people who do incisions, in fact people who use other people's clippers, people who go to the hairdresser without their own materials, sharing of these things give room or exposes an individual to this infection. Not to forget that this is also a sexually transmitted infection. So other people who are at risk include commercial sex workers, adolescent girls, people who experience rape, people who practice homosexuality, men having sex with men, women having sex with women, intravenous drug users. These are people that are at risk of this infection. And there are many complications. This could actually progress to the acquired immunodeficiency syndrome, that is AIDS, which is a complication from this condition. So Nigeria still records thousands of cases every day. Many people don't even know that they are at risk, but because I need to let you know there is an injection, I also need to let you know those who have been at risk of this infection. Now let's get into the facts about this preventive approach. The availability of this injection to prevent HIV infection can definitely mark a turnaround of the burden on Nigeria. So let's talk about what this is not. This is not a vaccine. This is not a cure for HIV. And this is not for people who are already living with HIV. This injection is for prevention of HIV-1 and it's for HIV negative people. That is, those who have been tested and found to not have the virus in their blood and want protection for themselves. So before you can receive it, you must test negative for HIV-1. You must also meet some other criteria, including that you must not have weight less than 35 kilograms. You must not also be having a recent exposure to HIV risk, like a commercial sex worker, or you have had a needle prick working in hospital environment or in a lab. For such, the post-exposure prophylaxis is what is recommended. You must not also have flu-like symptoms like fever, sore throat, malaise, feeling unwell, fatigue. This is an important vaccine for healthcare workers, young girls, adolescent girls, commercial sex workers, people who are involved in homosexuality or lesbianism. So as this injection has been approved by NAFDAC, it is rolled out, said to be rolled out between February and March this 2026. So availability, we'll talk about it in the next video, the cost and where you can take this injection. I will share in the next video. Let me know if you are interested in that so that I can share with you. The fact is that when this is implemented properly in Nigeria, it will help to reduce the burden of HIV in the country. It will reduce the risk of new infections dramatically. It will help to improve prevention among high-risk groups, as I mentioned earlier. It will, in fact, help Nigeria to move closer to epidemic control of this disease. So how is this injection taken? The injection is taken subcutaneously, given by trained experts or health worker. This is given subcutaneously, that is under the skin, and it is given twice a year, that is every 6 months. Is that not more convenient than taking tablets, oral pills every day for prevention of HIV? And these are some of the questions you may be asking right now. Is this going to be affordable? Is it free? Where can I get it? Like I said, the government of Nigeria has rolled this out in March 2026. Donor partnerships also encouraging the availability of this injection, and many health programs coming up will also help to fast track and facilitate the availability of this injection to Nigerians. So it's possible that it's going to be through government hospitals, different clinics, centers, that may include health centers. But for the private sector, we are going to be watching out for those who will be taking this up. Many nations have been included in this program. For African countries, Uganda has started, Zimbabwe, Lesotho, South Africa, people are already beginning to take and accept this injection for prevention of HIV. The fact is that this drug was produced by a United States-based biopharmaceutical company. In fact, I heard that a Nigerian was part of those who made this possible, was part of the team that produced this injection. Biopharmaceutical company based in the United States called Gilead Services. The fact is that not every hospital will have this injection immediately. So be patient. But the honest truth is this: this injection will not replace condoms. It will not prevent other sexually transmitted infections like syphilis, gonorrhea, chlamydia, even hepatitis B especially. This injection is specific for HIV-1. Let me know your thoughts about this good news, this invention, and how you think it's going to change the world, especially the impact on Nigeria and Africa. And be honest, would you take this injection, a twice yearly injection for prevention of HIV? Let me know in the comments. So this is your family doctor. If you are coming across this video and you like what you have watched, please click on the like button, give this video a thumbs up. By the way, you can also share this important news with your community, friends and family, and then you can subscribe to this channel for regular updates, especially on this particular topic, as we dive deeper into the other areas about this injection and then HIV as a whole. Thank you for watching. Thank you for the thumbs up. Thank you for the comments. Thank you for subscribing. I'll see you in the next video. You may like this next video or watch this playlist. Thank you. God bless you.